Hi, I'm Dr. John Young with Foundational Health Center here in Largo, Florida, and today we're going to talk about iron. Iron is just a mineral that is very important for the body to function, but we don't really think a whole lot of it. I get iron levels on most all my patients if they're complaining of fatigue, they get short of breath easily, they have hair loss. Losing hair can be a sign of iron deficiency. So I do an iron test often. Now, you can order a lot of different varieties of iron tests, a TIBC, percent saturation, and all of that. It got confusing to me. So I order a serum ferritin test. And that test tells you really how much iron you have in your blood. Iron is carried in the bloodstream as ferritin. The ranges are maybe from 15 to 200. And recently I had a woman coming in and complaining of hair loss. And we checked her thyroid, and the thyroid is great. But I mean, this woman hair is just coming out like crazy. And I did a serum ferritin test. It was like 8, very low. Got her iron level back up, and the hair loss stopped. So getting iron, you need enough iron. The dermatologists have told me you need an iron level over 90 just to grow a good head of hair. Iron is very important because it sits on the red blood cell and it holds on to oxygen. I have a good friend of mine who, because of surgery, lost part of his large intestines, and the iron is absorbed back into the body in the large intestines. And he would play tennis, and he'd play a game or two and have to take a break. And I got an iron level on him, and it was low, very low. Because if you don't have enough iron on your red blood cell, you can't hold on to oxygen. So got his iron level up, playing tennis normally, not getting short of breath, doing great. A lot of my patients, I will use iron to get their levels up quickly. They feel great when they do that. I'll also give them a little bit of IV vitamin C with the iron. They seem to do even better, absorb more iron. But no one wants to be stuck to get an IV all the time. So I'll put them on oral iron. And that, along with vitamin C, is much easier on the stomach. And I will keep them on that for several months, and they can quickly build back their iron stores. Because if you don't have iron, you can't hold on to oxygen. The other interesting problem that I've seen in my practice is I've had people come in with very low iron, and I give them the IVs, I put them on the pills, but they don't do well. It's hard to get the iron levels up. And I look at my textbooks and everything's written about too much iron. And you don't want to have too much iron, especially if you have cancer, because cancer cells love iron. So I like to keep my levels for my patients on the middle or lower end of the range. But I had to look far and wide to find, what do you do for people who have chronically low levels and the pills and the IVs don't work? And I've discovered there's a gene out there called the Hfe gene. And I've checked a number of my patients who have not done well with iron, and I find out they have this gene. This gene codes for the ability to hold on to iron. And we've had to talk to these people's insurance company and just tell them that basically they have a genetic disease, and they are going to have to get IV iron maybe 3 or 4 times a year just to function properly. So there is a genetic aspect to iron, being able to hold on to it, but there's also the dietary aspect, which I think is the biggest thing I see in my practice. People just not getting enough iron. And you may want to do that with a supplement. You may want to do that with changing your diet, eating more meat, green leafy vegetables can also help. Cooking with an iron skillet is also very helpful. But talk to your doctor next time. And if you're feeling fatigued, hair loss, your endurance for your activities, your sports is not as great as it used to be, get your iron level checked. It may be the reason why you're having some problems.